Today, we are going to present the testimony of a patient who had arthritic knee pain and who performed exercises and the pain resolved. I am Dr. George Ampat. I'm a consultant orthopedic surgeon from Liverpool. Thank you for visiting my channel. If you have not subscribed, please subscribe to the channel now for more helpful information on musculoskeletal conditions, that is, bone and joint conditions. We have an interesting real patient story. Someone who had knee arthritis and who initially wanted an injection for his pain was advised to have exercises. He was initially reluctant to do exercises and he wanted a quick fix with an injection. However, after further discussion, he decided to try engaging with the exercises. Within a few weeks, the exercise had helped him tremendously and his knee pain decreased. Not only has the pain in the knee decreased, but he has also found that his general fitness and energy levels have increased by doing these exercises. Exercise not only makes the arthritic joint better, but it has the ability to make the whole person better. Without further ado, I will take you to the patient testimony and you can listen to the story yourself.
Hello Stuart, thanks a lot for coming and seeing us. So tell me what's been happening with you and what has progressed so far.
Hi, I first probably started having pain in my left knee and right hand, and I went to see a consultant and they said it was the start of arthritis. Now my left hand was worse than my right hand, was worse than my left knee, and I got an injection in my right hand, which did actually cure the pain, and it has now been 6 months since the injection, which has helped. With my left knee though, I didn't have anything because they said it wasn't bad enough. However, it got worse and worse and worse, and I went to see a consultant and expecting, to be honest, to have an injection just like last time. Instant relief, great, thank you very much. I can go home and see the consultant again in a few months' time. However, when I saw the consultant, he didn't give me an injection. He said that I needed to build my muscles up around the knee joint, which would then help with the arthritis. And I went home and I was, I said to my wife, I was disappointed, if I'm honest, the first consult, because I wanted instant relief from the pain. The consultant gave me exercises, which again, I felt, okay, I don't really want to do them, but I did do them. And now I can't believe how the difference has happened, and I'm now actually wanting to do the same with my right hand and have exercises rather than another injection, because my left knee has improved so much since the exercises. I feel happier. I actually feel fitter by doing the exercises, and I'm going to now continue with the exercises. I'm certainly going to come back to the same consultant, and I don't know if I would like to name him. He's Dr. George Ampat, who is, in my opinion, has actually changed my complete opinion of between exercising and injections. And I will, if my hand does hurt again, then he'll give me more exercises to increase the strength in my hand. That's the way to go. Injections, instant relief, yes. But let's get back to being, what our bodies are about. Get stronger bodies, which will help you. Longer process, I admit that. But in the end, that, in my opinion, is the right way to go.
So tell me a little bit about what are the types of exercises you did, Stuart?
What
did you have to buy? What are the...
Oh, yeah, sorry. I did, Mr. Dr. Ampat gave me, he passed me on to a video that he did, and you have to buy what's called sliders. just a round disc which you put on the floor, and you put your foot on the slider, and you do certain injections with the slider, and the slider helps the leg move. And then other exercises, you then have weights that you tie around your ankles, and then you lift your leg with these weights on, and again that improves the strength. And another couple of exercises is, and I can't remember the term of them, but you're on a hard surface, either the floor or the bed, and you have to lift your body up on the side, first of all, on both sides. You lift your body up on your elbow, and then you lie on your back and you lift your back up with your feet and your shoulders. And I think there are 12 exercises altogether, but every single one obviously does a different strength exercise to your leg. But each one I have found has really improved what my pain I am going through, and I'm not in anything like as much pain as I used to be.
Thank you so much, Stuart. I mean, thank you so much for taking the time and even telling your name and allowing us to videotape with your identity being revealed, because this will inspire patients. Because what the most important thing is, a lot of older adults are very scared of doing exercises because they think that will do more harm. So it is good for you to have come out in the open and explain this, that how exercises you found relief, because we want everyone to do that. This is without any cost, without any potential risk. Exercises has no risk. An operation has risk.
Yeah.
Injection has risk. Medicines have risk. Whereas exercise not only makes the arthritis better, but also makes the whole body better by exercising and improved fitness. Thank you so much for taking the time to come and do this.
No problem. Thank you very much. And just one final thing. Yes, to anybody listening to this, absolutely, exercise for me is the way to go.
Thank you so much.
Thank you.
Thank you.
You heard this wonderful testimony. I'm so grateful for that story. This is because a lot of older adults are worried about doing exercises. They think exercises will cause more damage. That is not true. Yes, it is possible that if you have not exercised for some time and you have arthritic pain, there may be pain when you start exercising. However, research clearly shows that if we persevere with exercises, the pain will decrease over time and the joint will move better. It is important to slowly and gradually increase the intensity and the number of repetitions. Too much, too soon would be a boom and bust. Each person has to work at their own pace. The simple method to follow is a traffic light system. When the lights are on green or where there is no pain, then you can exercise. However, when the lights change to orange or when you start experiencing discomfort, you need to try to stop exercising. Stop exercising when there is pain or when the lights are on red. Just like our traffic lights, it will not remain red forever. After a short time, the lights will turn green and we can go again. Similarly, resting between exercises will allow the muscles to rejuvenate and re-energize, and then you will be able to exercise once again. Even if you are waiting for a total knee replacement or a total hip replacement, exercising can only help. There is some evidence that by exercising, you may not need that joint replacement. In addition, exercising will build your muscles. Having strong muscles before the surgery will enhance your recovery and prevent complications. Research evidence shows that people who exercise before surgery stay in the hospital for a shorter period, have fewer wound complications and infection rates, and they are able to achieve better outcomes from the operation than people who have not exercised prior to surgery. Exercise is a win-win situation. It is a win to help you avoid surgery. In addition, it is a win if you finally need surgery, as your outcome or result from surgery is going to be better. Thank you very much for listening. If you enjoyed watching this video, please like, comment, share and subscribe. Though I am an orthopedic surgeon by training and practice, my main focus is on helping patients with musculoskeletal pain without surgery. I have written self-help books to empower patients to find relief from their symptoms. The QR code provides a link to my books on Amazon. These books are also available on my website ampat.co.uk. Thank you so much for listening. Goodbye.